physiotherapist, clinic owner, entrepreneur, and one of the most influential mentors in the Canadian rehab space. Today on the Staying Relevant podcast, I'm joined by my friend and colleague, Darryl Yardley. From founding Mentorship Bootcamp to helping grow over 400 clinics through Clinic Accelerator, Darryl has shaped the next generation of clinicians and clinic owners. But beyond the business, Darryl's story is one of reinvention, resilience, and relentless curiosity. In this conversation, we go beyond the titles to unpack what it really takes to stay relevant, not just in practice, but in life. Ladies and gentlemen, the Darryl Yardley.
If you're coming in to work with us in the clinician training program on bootcamp, but the reality is if you truly want to improve, and it's sort of something that hit me early when, one of my very first mentors told me I was a shitty mentor.
We have the 3 C's when we're looking to hire. Good communication, because that's where that falls in. Can you communicate with the client, which is then going to set expectations? Are you coachable? And do you have a continued desire to learn?
Yeah.
We call this the 3 C's for when we're hiring.
And at the end of the day, if we're always lifelong learners and our job is how can we be 1% better every clinical day, every week, every month?
Thanks for coming on, Darryl.
Hey, Tom, thanks for having me.
So I want to start off where you've held multiple roles as clinic owner, CEO of Clinic Accelerator, founder of Mentorship Bootcamp, and a university professor. How do you balance each hat and stay true to your core mission, through your entire career?
Yeah, it's a great question. Probably, my Achilles heel is wearing too many hats at times, and maybe losing a little bit of focus. And then, quite honestly, my wife will tell you it's a bad idea. But I think usually, typically, with each of those little, roles that you've identified, they all have one unique driver, right? Which is, what can I do to have influence over changing a system, right? Whether it's an educational system, whether it's how we practice in Canada, whether it's how we really look differently and really try to break down the barriers between business and patient care and outcomes. Those have always been passions of mine. And the reinvention that you kind of alluded to as we kind of did the intro there is there's always got to be a way to reinvent how we do things. And a lot of that comes from making mistakes. And I think wearing multiple hats, you make a lot of mistakes and you have to learn how to either fix them quickly or surround yourself with smarter people to actually help you fix them too. So I would say, all of those roles that you did identify, I had partners and colleagues and support systems along the way the whole time. And, mentors in the space and outside the space, and mentors that slap you around a little bit to knock some sense into you. And it's a hard pill to swallow, but once you kind of deal with your bruised ego, you usually can smarten up and be a little bit smarter and get refocused.
How do you instill that with your clinicians that you mentor? Feedback stings. You're not always going to be awesome. You're going to make mistakes, and encourage them to continue to move forward rather than crumble under the pressure and, quit whatever job that they don't feel like is right for them anymore, just because they got feedback that they didn't want to hear. How do you work around that? How do you tell them, don't just walk away from something because something didn't go your way?
Yeah, it's a great point. I think things that I've sort of seen over the years and maybe even had exposure to, and I think as I was doing my post-grad clinical training and development, I had some really good mentors that weren't about putting themselves on pedestals.
Yeah.
I had a few that did. But what I learned from that too is, this is someone I want to aspire to get towards, and that person constantly push you to get beyond them. Right. That was a big piece for me. So I think in order to get people and practitioners and healthcare professionals to kind of exceed expectations that probably they even have for themselves, is to make sure you're not really just focusing on everything you did well. Right. You really have to focus on paying forward mistakes and failures. So they also realize that, it's not as easy for me versus them, because I went through the same trials and tribulations, right? And it's trying to really instill upon them, I'm going to give you this feedback because I actually want you to develop quicker than I did. I want you to still make some mistakes because that's part of the learning journey, but I don't want you to make the same mistakes I did. My job is to tell you and kind of alarm you for those, components that are likely to come. And the reality is practice isn't easy. Like practice is hard. I think the treatment part of what we do is easy, but knowing what to do and how to manage people in a system that quite honestly is constantly changing. And, think about now, right? Like we come out of the pandemic, we're dealing with inflation. Now there's this whole like tariff thing. Like it's just stressful. The costs are going up, and the clinicians have this extra burden that, quite honestly, I didn't really have, to the same degree when we graduated, right? I think that's a really important step. But I think too is, errors that I've made in the past is you really try to, comfort somebody initially, and you don't really give some of that stinging feedback that should be constructive at times. It's like, well, keep going. It's like, no, like you got to set that stage right up front, right? If you're coming in to work with us in the clinician training program on boot camp, if you show up to office hours, I'm going to give you like the reality of what I see here, right? They know that. Whether they choose to come or not, that's up to them for office hours. But the reality is, if you truly want to improve, and it's sort of something that hit me early when, one of my very first mentors told me I was a shitty mentor. Like as a clinician, right? And he was like, you suck at this. And I was like, oh, okay. Right. I was with PT Health, and I was like the director of professional development, wherever the made up title. Right. And he is like, you suck at this. And I'm like, oh, okay.
Were you making people cry? Okay.
No, not at the time. I think I wasn't making anybody cry because he made me cry. And I was like, oh, fuck. Okay. Like, I remember going home, and I don't even think I might have just gotten married. I was like, no, this is bullshit. Right. I'm out of here. This guy says something. Like, this guy basically just, took this, wind right out of my sail. Right. But the choice was crumble and leave and go do something else, or suck it up, learn from it, and let that be your growth opportunity. Right. So from that perspective, I think it was always about setting expectations for people, and don't blow smoke up their ass. Like, I think it's actually a disservice to them if you are going to be truly a coach and a mentor.
Yeah, it's not in our facility. The expectation is so high from us, to be exceptional in every aspect that you do. From clients coming in, they've been everywhere else. They're coming to us. So, we've learned over time, like, this is not an easy place to work, because there's so much to learn and there's so much to unlearn. And it's fun. Like, the culture is solid. Everyone loves being here, but the expectation, there's pressure. And, we provide the tools and the coaching and the mentorship weekly, and, the one-on-one time to kind of go through case studies. And I think a lot of clinicians don't realize, whether you're new to the game right out of school or you've been doing this for 5-10 years, when you come into an environment that's successful and everyone's trying to constantly elevate themselves to be better, there's an expectation that, well, you kind of have to keep up. What you were doing before might not be good enough, but as long as you're communicating and you're coachable and you want to learn and you want to level up, then great. Like, it'll all work out. But if you don't, and you're going to do it your way because that's the way you've been doing it, well, that's not going to work for us. Like, we've lost clinicians who've been doing it for a number of years, and they just like, well, I'm going to do it this way, but it's not working. Like, clients are not staying in your calendar. They are falling off. They're not happy with your service. So therefore, maybe you do it our way. And if they're coming in, they're like, schedule's full, everyone's raving about you, who am I to say that you need to change? Like, keep doing what you're doing, right? Like, that's why we measure stuff. But oftentimes, some just get fixed in that, well, don't tell me how to be my practitioner and I do it my way. I'm like, yeah, but your way sucks. And it's, the numbers show it.
Yeah. And even for me too, I said that to somebody the other day. I was like, you know what? If this patient gets to the end and you tell me that they're actually like, they've returned to whatever their original goal was, I'm cool with that. But you better have an objective measure that you can prove that to me with. Yeah. And I'm not being an asshole. I actually want to know, did this patient, restore this level of low tolerance, capacity, whatever it may be, but you can't tell me you've done that in 3 visits for someone who's had a condition for 13 years. It doesn't make sense, right? But one of the things that's interesting too, Tom, is I get to spend a lot of time with some of the orthopods and sort of seeing what they do in medicine. It amazes me how they constantly collaborate together, huge trials, whether they're in Canada, they're global, it doesn't matter. And it's like, okay, should we be changing the way we do things? I couldn't tell you the last time I set foot in a
Yeah.
rehab room that said why we should all change how we practice.
Yeah.
You know what I mean? Like it's interesting because as you say too, it's like, our way works. It does.
Yeah.
Like I can prove to it. But then when, times where people will come in and I often, whether it's, interviewing in our clinic, or if it's, meeting people for first time in, boot camp, even the clinic owners, most of the clinic owners are still practicing clinicians and operators. Right. So kind of sit there and it's like, okay, well, tell me a little bit more about, like, why did you become a clinician? Oh, I want to help people. Great. But do you really want to help people and continuously surpass your service delivery and value
Right.
every week? Yeah, of course. Okay. Well, that comes
Yeah.
with feedback. That comes with you doing some work if we really are lifelong learners. I honestly feel, and I'll say this on this call too, I think lifelong learning is bullshit for
Right.
most people. They don't want
Right.
a lifelong
They want
learner.
to coast. There's like, I want to get to a level. This is
Yeah.
easy. I'm getting satisfactory results and I'm getting my paycheck.
Yeah.
So I'll show up for work and I get my work-life balance. Yeah.
Yeah. And the thing too is, and I think sometimes though, there's also people that really do want to learn that, but they don't realize that lifelong learning can happen inside the,
Yeah.
the clinic or the business they choose
Yeah.
to work within. Right. Like if I was just to listen to, you and I went through the level system together, like simultaneously. Right. But I've also listened to some of your work post level system and I'm learning stuff there too. Right. So it's all about how you're going to, kind of assume and retain knowledge now, but then apply it. But you have to want to apply it. You're going to have to really be a critical thinker and evaluate your practice. So, we always talk about clinical reasoning, critical appraisal, all those things, right? But the most important part is how do you critically appraise your own practice right now? It's not about identifying it where you suck. It's like, no. Like we still get people better. You and I got people better when we didn't know what the hell we were doing. But I'm a hell of a lot better at it now, as far as like, communicating to a patient what we are going to do together, right? And how we're going to get there, and my timelines, et cetera, et cetera. But I by no means have coasted by doing the same thing I did 20 years ago.
Yeah. What's the line between, mentoring and coaching and micromanaging? Because we've gotten that feedback, right? Where we're trying to help you to be successful and we're trying to coach you to get successful. But then it's like, now it's interpreted as, well, you're micromanaging me and, stop telling me what to do.
Yeah. Yeah. It's interesting because it almost goes back to some of these like buzzwords that exist right in the industry too. Like I want autonomy. Okay. Like what do you want autonomy in? I don't want somebody to tell me how to treat. Okay. Sure. But are you willing to get feedback and are you willing to work kind of within kind of a standard system that we have in regards to what I want patients to experience every time they come through my door, right? Same with you guys. And you guys are probably even a little bit more structured than we are because you've got a beautiful system people should be following through what you guys have done through or what you've done through AMT. Yeah. But I don't really have a lot of wiggle room if you don't follow the strategy to drive patient experience. I really don't. And I'm going to give you feedback on that every week. And then it's really going to be up to you. Like if you don't want that feedback, I'm open to you giving me let's chat about it. Like how else could I provide you some of this feedback? Do you want to work with, let's say for example, like they look at you and I as the owners, right? So now it's a micromanaging thing, but quite honestly, okay, if you don't really want that, how about I partner with someone that has already maybe understood the concept, done some unlearning, right, from how we were trained, and then, you can kind of do a peer-to-peer follow-up. So I think it's a little bit more about what options are there, but most times people will tell you the micromanagement once they already have one foot out the door. Right. So then you're like, now you're in desperation mode to retain because none of us have enough staff, right, for the volume of patients we could serve. So I look at it in a way now too, though, is like, tell me how you want to be autonomous in practice, but tell me how you want to balance that out now with professional development and your lifelong learning to become a better practitioner.
Yeah.
Tell me. And then we look through that, but that's only in hindsight. That's not kind of what we've all experienced. It's just like, that's the approach I had before. it worked for some, it doesn't work for others. The ones that I retained, great. What can I do to kind of revisit that? Once it, sometimes to me, like the staff you lose is your biggest learning opportunity.
Yeah.
Sucks.
Yeah.
It stings, but it makes us better as owners.
Yeah.
And mentors,
It's definitely
right?
changed a couple of our interview questions and setting the expectations and really listening to their side of what they are looking for in a clinic and in a culture. And now we have 2 extra questions on our interview practice. And if they, they say no to these 2, then it's almost like, all right, this isn't going to work out now. Right. Just because they're like screening questions of whether, do you work,
Mm-hmm.
do you believe in working as a team? Working along with PTAs, movement coaches, chiros, like, interdisciplinary. And one of the other questions is, do you have a movement practice? Because if they don't, well, then I know you're not prescribing exercises, or you don't care about that side of things, because what you don't practice, you won't prescribe. And
right.
So those are 2 added questions, because we're very movement based. At the end of the day, people got to move, they got to load, they got to get back into their performance, whatever that is. But, just doing some manual therapy and a couple of little exercises is not going to get them better 100%. So, those are 2 questions we've added specifically for our clinic in our hiring process based on, past experience and those stings. Now that, go ahead.
And I think even on that too, like I'm pretty transparent with people now too, like especially on so like if you want to make a higher perceived percentage or a higher perceived income, you're not really keen on, consistent structured mentorship, this is not the right fit for you.
Yeah.
Right. Like I don't really have time for that anymore. Like if you want to learn and you want to have support, like extra support, quite honestly, like it costs us a lot of money to do this. This is the right fit for you, but I'm also not going to get into a pissing contest over a 5% fee split. I don't want that.
There's lots of coaching and consulting out in the landscape. Tell me how you feel about the current situation of, who's qualified to be coaches and consult on, various aspects of business, entrepreneurship, physiotherapy practice, healthcare. What do you see going on in the industry with regards to that?
Yeah. I quite honestly, probably in the last 3 years, really kind of like mid-COVID to where we are now, right? It's almost like a clinic. It's like a new coach is popping up every day on Instagram, right? Or on LinkedIn, or somebody's now saying, hey, I can get you 30 new patients, just follow my system. I can just go to the employer guy down the street and get 30 new patients. I don't have enough staff for those 30 new patients. I don't need this, right? But I think for me, what's really interesting, and I've learned this from Rick, right? Like Rick Lau, like Rick's brilliant on the marketing side, right? But for me, it's like diving a little bit deeper. Like, okay, what's your social proof? Like, what have you done for other people? And quite honestly, I don't even really care about that, because I can get my buddies to write a testimonial, which is, I never did anything for them. It looks good, right? But the truth is like, tell me about your practice. Tell me about, what's the profit margin of your business? Like, how many staff do you manage, right? What are your systems and processes look like?
And a lot of them are solopreneurs that are like, well, I don't really want to practice anymore, so I'm just going to go into the coaching thing and coach clinic owners with 30 plus staff. I'm like, what staff and people have you managed? This doesn't make any sense.
And and you and I both know this, like managing the people of our business is the hardest thing we do. Because you've got like, we're responsible for people's mortgages, car payments. Like it's not just the risk of going into the business from, a capital perspective. It's the risk of like, if I don't run this really well, I have to remove people from that business, right? Which rely on that paycheck every 2 weeks. So there's just more that goes into it. I think the other thing too, even for us, like when we chose, how are we going to develop Clinic Accelerator? One of the biggest things I don't know anybody in our industry, especially, that can actually do everything very well, right? Like I'm not a marketer and I hate marketing, quite honestly, but Rick's brilliant at it, right? But Rick's also not going to try to sell somebody how to coach their clinicians to be better. Right? So, when we did that, we actually looked at to say, okay, what instead of just entering into this space as another coaching company, what's different about us? It's like, well, we actually have a collaboration, if you will, of the original partners that all had different strengths within running a healthcare business. But then we also developed some of our coaches too, who also had different skill sets and attributes to, again, beef up what we were actually able to support people with. I don't think there's any opportunity in this game to coach somebody individually. Quite
Well,
honestly,
even just on all
I
the
think
realms that you're just talking about, like you said, your Clinic Accelerator, your boot camp, it's taking care of all the buckets, and us, sending our clinicians into your boot camp for case management. They can hear it from us, but when they see it as a group with group coaching and everyone struggles, and how do I do that? We can try and do it as best as we can, and our clinic director is quite good at it, but to hear it from an outside source, it's just going to land differently. And once our clinicians get in, once they do your course, once they do your boot camp, things start to click for them differently. It's like hearing fatigue. They hear me talk every single week at mentorship, and I know I've repeated myself a few times, but maybe this 17th time it lands a little different, or they just need that repetition, or they need to hear it in a different way, or maybe somebody else just kind of helps interpret it a little bit different. But the Clinic Accelerator and your boot camp, it's so valuable because everyone's got their expertise and you get access to all of them, which is super helpful because now us as clinic owners, I don't have to wear all the damn hats.
Yeah. And I don't have to try to learn marketing, quite honestly. Right. And same thing too, isn't it? It's like, because we work with so many owners, it's like, hey, we tested this with this owner and it worked great. You should try this. Right. Like, and that's really the whole premise of creating that community. And again, we still have, those that aren't in the community still like this, like push pull, like, oh, I don't want you to learn my secret. Like, there is no secret sauce in this industry, quite honestly. Right. Just learn how to friggin' execute and get your team to execute. That's the secret sauce. But it's not secret. Right.
With the, you've helped probably over 400 plus clinic owners. What's the most common blocker you see, and how do you coach them through it? What would you say their bottleneck is for a lot of clinic owners?
Yeah. The bottleneck is us. Yeah. Like, I would say 80% of the clinic owners, right. And it's not because we're assholes. Like, it's legit just because we try to do everything. Right. Because at one point we were that solopreneur for the most part that went in and started the practice. Everybody knows who we are. And the one thing that amazes me with the majority of owners too is that despite trying to learn how to like operate and run and grow the business, they're still developing themselves clinically.
Yeah.
You know what I mean? Like, how do I get better? You know what I mean? Like, I got an owner the other day. She's like, should I do my master's like I did and, finish my fellowship? And I was like, you could, but you also are still in the red. Like, you need some profit in this business. Right. So, and I think though the hardest part too, that we see with those that do get into their way, because we're really good at what we do, especially from a patient facing. So like working in the business, we're exceptional at it. Working on the business is the part that we almost avoid a little bit. So, we avoid the difficult conversations. We kind of let things brew. And even for me, like, I used to be like, oh, I'm so busy today, I'll deal with that one later. The clinician patient busyness is irrelevant compared to like that difficult conversation I should have had. I could have predicted that, right? Just like you and I can predict outcome for patients, right? Like, really well. And I think if more owners were thinking about, okay, how do I develop my leadership team? How do I communicate things that are in my head better? And honestly, if we really took what we do well in the business, right, of working with patients and started to like figure out, how do I develop my leadership team? How do, like, you guys did this beautifully, right? How do I create org structure? How do we divide and conquer what we do? And then you really have to start to make that turn to working on the business, which is a very hard thing to do, especially when all of us, our identity is patient care. Like, we're all physios, chiros, psychotherapists, like natural, like that's your identity. But you enter the business space. That to me is the big transition that a lot of people struggle with. Hence why they do still 60 hours a week.
It's an identity that a lot of us, it's hard to let go of, right? Because you start the business, you're the person that everybody wants to see, but your time is limited. And it wasn't until, again, like I'm going to say, COVID forced us to pivot, rethink, reorg, create the roadmap, create the value system, create the mission statement. Because it was almost like every year it'd be like one in, one out. We couldn't grow. And until we took a step back to reorganize exactly what the plan is with this company and then start sharing that with everybody we hire, our retention went through the roof. Like we're continually hiring because we're growing, not because we got to replace somebody. But it was on us as the clinic owners. I'm like, okay, we know our vision, but nobody on the ship knows what direction we're going in. Nobody knows what their role could be. And creating that org structure and showing them the roadmap hey, you want to be a clinic owner and be a partner with us? Here's the map. We got to put you in leadership positions. Make sure you like that first, and then you get into clinic director. Make sure you like that as well. And if you don't, or you're happy there, great, stay there. But if you don't like doing that, do not become a clinic owner. Right. And and then the other thing that took me out of, not having or being fearful that, if I don't see clients, they're not going to come. I got sick, took me out for a year. And then was like, okay, well, I like it here. I'll just see one of Tom's partners that he's worked with and trained. And it was one of those, like, a really weird blessing in disguise, but it's actually by pulling me out, it's allowed the clinic to actually grow faster, which is weird, right? And you don't think that as a clinic owner, but looking back, you're like, well, the only way this can grow is if I'm working in the background and not being the face of the company anymore, and not everybody relying on me, and create the systems and create the back end stuff that everyone can just lean on the systems, lean on the framework, provide the education for continual growth, and the ship is moving forward. So it's tricky as the clinic owner, because you want to wear all the hats and you want to have all the control and the last say, but at the same time, you got to trust the people that you put in those positions to make the right decisions.
Yeah. And I think, we see this on the clinical side. We see it on the admin side too, right? It's just easier if I do it, but it's not, right? Because even for you and I, we can only see so many people. There's only so many hours in a clinical day, right? So there's no scalability to that. So when a lot of times too, people sort of, approach me like, do you miss it? Right. And I'm like, well, I'm still in there and I still do consults and I'm still in clinic on Mondays. Right. But the thing too, for me is it's no longer about, there's still an ego, boost there for sure. Like, people ask, I want to see Darryl. And it's like, okay, but I can't see you anytime soon. So it's not ideal for you to wait to see me. This is who I've worked with. But when you think about the ability to get people around you to learn from you and do better than you, right? It's a win-win, but it's hard to get there because it is easier to just do it yourself at times, but it's a very narrow way of thinking. It's like looking at the trees and you don't see the forest, right? That's what people have to think about. And it's hard to do, but also, like, and if it goes back to, that very first, hard lesson I had from my mentor, it was like, we had no system, we had no processes. I never took time to develop it. So whenever I would kind of go from start a clinic, fix a clinic, rebuild a clinic, start a brand new startup, every time I would leave a location, the clinic would tank. And I was like, that was the big, rude awakening. And it was like, but why? I was like, I think this guy I mentored was awesome. This girl, like, she's fantastic. But what it was is I never learned how to systematize what I was doing. And it's interesting because the reality is you looked at it based on profitability. And everyone was like, well, you're the business guy. I'm bullshit. Like, if that outcome wasn't good, it wasn't good enough, right? Like, I would totally tear apart things that we did. You shouldn't see this patient because they don't pay us enough. Bullshit. There's a way to make that work. You just have to understand when that, for example, when you come in to see me and I watch your wife carry you in and she's got a sprained ankle, I'm going to treat her too. Right. So it was really interesting. But what's happened, especially too, for me, it's like you still be seen as this like guy that, prescribes way more than the average physio, which I don't. But the truth is like I have a very different way of going through things now versus what I didn't do before. Right. But it is challenging because a lot of people don't think that way. They're not looking at every opportunity. When I see that, same thing like when I was, decided to coach last year. It was the most time like coaching hockey. But when I saw that, do you know how many like physio referrals I was able to get by like people learning, well, what the hell you're a physio? What do
Right.
you do? Like that was literally conversations between
Yeah.
practices and games. I'm like, you don't never been a physio? No. Like to me, this is a huge opportunity to educate people on what it
Yeah.
is that I do. And when I see something that I can
Yeah.
actually help, fucking right. I mean, I'm gonna be like, you get into my clinic, right? Like it's
Yeah.
a no-brainer. You should want to help more people. The question is
Yeah.
who's doing that? I probably would say 90% of those people that are like, you should
Mhm.
be in my clinic, saw one of my colleagues who are really good or getting
Yeah.
really good.
What, of all of the clinicians, 5,000 plus clinicians, what would you say like the
Mhm.
top 2 to 3 transformative habits that separate all-star clinicians from the rest when we're talking about trying to, get them
Um,
leveled up?
yeah, I would say the most important one, and it doesn't matter what stage of your career in,
Yeah.
are you coachable? Right? Like I've seen, and we often think about, we teach treatment planning right off the bat, right? Like, how do you present your plan of care? Those that see it as a task,
Right.
they're not coachable, right?
Yeah.
It's not a task. Um, and I'll give you an example. I had this brilliant chiro come in the other day, and I was like, "Hey, let's go through your plan together." Like I got because she had a hard time retaining patients. And I said, "Okay, let's go." And she's telling me everything she did. I was like, "That sounds awesome," but I don't know. I don't understand a goddamn thing you just said. And she's like, "What?" I was like, because in my head, half my brain was like, "I
Right.
wouldn't have done that. I don't know
Right.
why you did that. What did that test?" But that's where my
Sure.
clinical brain went. But if I'm a patient, I don't understand any of that. And you didn't say anything about
Right.
me. Like I'm the patient coming in here. And I just brought it right back. I'm like, why is this person coming to you again? Well, they backed me. And I was like, no, no, no. Why
Yeah.
are they here? Did you not watch the very, very first video of boot camp when we're like, do you remember the old gentleman who, you
Wants to
know,
pick up his
was
grandchild.
trying to pick up his granddaughter at the, like, did you not remember that? Oh yeah. I'm like, well, you
Right.
didn't watch it. I know you didn't. Right. Like let's cut the shit. You didn't want to learn that. Right. So I think for me, when I see some of those people that we're often afraid of too, like, oh my God, Darryl's been practicing for 20 years. He's not going to want to learn this. He
Yeah.
should want to learn this because it makes our practice more efficient. And at the end of the day, if we're always lifelong learners and our job is how can we be 1% better every clinical day, every week, every month, whatever you want to coin that objective measure to or that improvement, it comes by us being able to communicate what we can do to patients even better. That's it. Doesn't matter where you are in your career. And we get tons of great buy-in from those individuals, but I also get pushback from those that are like told to do, you got to do training with Darryl and boot camp. No, I don't want to do that. If you make me do that, I'm going to quit. Then I was like, give me 20 minutes with that clinician because I'm going to go right back down to why did you
Yeah.
become a clinician again? And prove to me that that patient understands
Yeah.
everything you just said. Because we still don't, right? So I think from that perspective, the coachability for me is the big one. And I think the second part too, though, is the things that really make it successful is when they have good supports to then go back into clinic with to get resources to apply. So it's not even really the person only, it's their ability to have a partner at the local
Yeah.
clinical level. Like someone like you that says, okay, you know what, I've been doing this treatment planning. There's something here. Tom, how, I keep running into these barriers. What's your barrier? Okay, finances. Great. Let's talk about that. We didn't learn that stuff, right? But sometimes what I'm finding is that they don't have that partner, and then they don't make time to come in and get feedback from, like, let's say myself or Rhonda Shishkin who works with me there. They don't they don't capitalize on the
Mm.
resource, so they're only getting a small fraction of
Right.
support, right? So, and I would say that the third one though for me is the ones that really, quite honestly too, and you know this, like when a clinic owner um, enrolls them into the program, it's
Yeah.
covered by the owner, right? The cost of it. Those that pay on their own and they have more invested
Mhm.
interest now, they're way more accountable to doing the work because they
Right.
they paid for it, right? They need that
Yeah.
self investment. They kill it, and I would say everyone, I shouldn't say everyone, but 80% of those that have made that investment in their own life, in their own professional development, have become leaders in some way, shape, or form in that practice. Clinic director, clinic lead, And many of them are actually junior partners now. So they went from just being that clinician working for you and I out of school to now being an equity partner, actually helping us expand and grow our mission to serve more people.
How do you sell that though? Because, they come out of school, they're like, oh, I need to get clinical tools, to be effective, to grow my practice, which is important. And we encourage them to do that, which is why we invest in them, early on to do so. But how do you get them to recognize that the other side of the coin of having a successful practice is actually maintaining your practice and the communication and then getting them to invest, like use their own money to invest in this, business development course, because they don't look at it as a business. I'm like, you are a business, you're a salesperson. You're not selling directly, but you're selling because you know the product, you know what the product does. You're educating the person on the product. They're going to like you. They're going to buy from you. But, it's when they're making a toss up of, well, I only have X amount of dollars. And like we pay for all of our staff to go through your boot camp. I want to take a quick break from today's episode to share something I believe every rehab and performance professional should know about. For years, I saw too many clients go through the same cycle: short-term fixes, temporary relief, and then the same issues coming back again. That's why I built the Advanced Movement Therapist certification. It's not just another course. It's a system that helps you identify the real cause of a client's pain, give them results that actually last, and stand out in a crowded industry. You'll get practical tools and strategies that you can take straight into your sessions so you can help people get better faster. If you're ready to become the go-to clinician in your community, head to amtcertified.ca to learn more. That's amtcertified.ca. Your clients will thank you. So that they can build their practice, they can build their business inside of our business. How do you find the clinicians, or the ones who will pay on their own, like they'll just fork it out? And like, how do you communicate the value?
Yeah, I think, well, the ones that come, that do come and pay on your own, most of them have hit like a really like sore spot, right? Like they have no patience.
Pain.
You know what I mean? Like I don't make money. I got a great fee split, but you don't have any money, right? Like, do you want 70% of like $100, right? Or do you want 50% of $300?
Yeah.
Like, what do you want? You know what I mean? So the sort of that, putting that math aside, I think the interesting thing for a lot of people, though, I do think it comes down to a bit of a huge gap and limitation in the educational system, right? Like, we know that 70% of graduating physios, as an example, 100% of chiros for the most part, are all going in private practice. You have to understand that there's a clinical development kind of pathway, and there's a practice management pathway you have to be good at too, right? It is what it is. And quite honestly, I have a whole other pissing contest that I have to deal with when it comes to like why we don't have to think that way in the public system. It's also why, most physio departments have become eroded in the public system. But we'll say that for a future.
Well, I mean, you've done some business and entrepreneurship teaching at Western, right? How did you bridge the academic theory with that real world clinic operations? And then what are some of the downfalls that you saw with the current education and training system?
Yeah, like I think what happens too is, and you and I probably were in the exact same situation, right? Like, you come out of school and you've got these great, clinical faculties surrounding you, right? And you're like, I want to be like that guy, right? And then we get into our first clinical course afterwards. And I think, most of us all went to like level 2 orthopedic division, right? That's what you did. And you realize like, shit, I don't know anything, but you do, right? So I think, and no matter how many times we tell people, you know what, like you do know a lot, you have great competency, but what's missing is most people don't have the confidence in that competency. So, and even for us now, like, you and I probably could go down a list of how many courses we both took in our first year, but we would tell every single person, don't do that, right? They're not going to listen to us because we didn't listen to whoever told us that, right? So I think it's one of those things when I look at it, though, is when I saw the big gap was I knew people were still going to go down that clinical pathway, but it was almost like, could we get them to just pump the brakes a little bit, right? Like just find a good clinic, find a good mentor, right? And then from that perspective, then start to carve out your con ed pathway. Like, what do you see? Who do you see? Where was my strength as an example versus, I've got guys that come and work with you because I don't have the same strength on the movement side. Right? My strength's on the manual therapy side. So that worked, right? But I think what I did see was people entering into practice blind, right? So that's where we try to merge the practice management and leadership side of what we do and trying to remove the sales feeling in regards to clinical practice and healthcare. But that it's a massive gap. Like, and even when I would teach, the business and practice management course, and then if I saw those guys a year later, they were like, whoa, what you actually taught there now makes sense.
Yeah.
But the first year it wasn't relevant to them because it was never really seen as something that was important in healthcare.
It's not valued at that time, but once they've been in it for a year and they realize, oh, there's more to this profession than just treating people to keep them completing their plan of care, to keep the schedules full, to, get better outcomes. Yeah, it's a 50-50. You got to be 50% skilled, but you also have to be 50% competent on managing expectations and communication and coaching and, measuring outcomes to prove what you're doing is actually working. One of the things that I keep, we take students from U of T, we're in their catchment area, and we just had a student, this is their first placement. We don't normally take like first placement students. We usually want them to be in their second year to have some orthopedic. But I realized, I'm like, oh, you know what? She doesn't have any bad habits yet and preconceived ideas. So, I gave her my level 1 for the AMT and she was working through it. I said, what do you think? She's like, this is helping me make sense of everything I'm learning in school. And it's organizing my whole process. So then she's not even done her first year and she can do the first 5 components of assessment. Taking a history, looking at analyzing posture, creating theories and hypothesis, looking at a global movement scan, do your neuroscan, and then compare your active and passive range of motion to all the pieces, right? Like we learn all that stuff in school, but it's not systematized. It's not organized in a usable way because they still compartmentalize. Oh, it's shoulder labs. And they learn everything about the shoulder. They learn how to diagnose shoulder. They learn what is the cause of pain. They don't know why it's there. I'm like, there's nothing to bring it all together because the body's a system and it's integrated. And if one part's not working, you're going to compensate someplace else, which is typically the painful area. So it was interesting to see because I'm like, our movement coaches go through the AMT and there's some advanced neurology in that, but they get it just fine. Like it takes some practice and some repetition. But I'm like, well, yeah, why wouldn't a first year physio student not be able to know this too? Like they have a kin background. And she did amazing. I was like, oh, like, let's just take the students on their first one rather than their 4th and 5th. And then now when they go into their other placements, they now have at least a framework to work from in an orthopedic setting that they can now utilize when they start building all this other knowledge on. But it's almost like it's backwards. Rather than look at the body systemically and then break out, they're like, well, let's look at all the parts and pieces, but we don't have time to put it all together at the end. You can go figure that out on your own. And it honestly doesn't take that much time. It doesn't. Yeah, it's not hard.
And I think I can't remember too if you guys were similar to us, but I remember like everything used to just be system based, like when we did our undergrad, we did our professional programs, right? Like we did cardio rest, we did neuro, we did ortho, and now they're trying to like really make it a little bit more holistic as an approach, trying to integrate, but it's still very piecemeal for these guys, to really comprehend. So. And again, bringing in that younger graduate early is great because they now can also see chaos in some of their like upcoming placements, right? But here's the one thing that I have issues with too is the understanding of reality of practice, right? So I was doing a kind of a lunchtime session with our team, and we're kind of rolling out our new kind of just an upcoming version or an updated version of our treatment plan tool. And I said, okay, guys, let's get even more specific around milestones and why we're recommending what we do. Right. And then what are the barriers? And the one thing that was really, really interesting, I said, what would make, you and I, Tom, choose seeing someone twice a week versus once a week? And we had these 2 MAC students and they were great. right? And they were like, money. I was like, what? I was like, the hell's wrong with, what do you mean money? Yeah, well, what their insurance is. I'm like, first of all, no one even does
No.
insurance checks anymore. Even though I still did, everyone just stopped doing it once I wasn't in clinic enough. So I was like, wait a minute, who told you that? Like, how do you come at like, well, we learned in school that we really have to be mindful of someone's finances. And I was like, you've got to be shitting me. Like, are we still teaching that? Like, that's the dumbest thing I can honestly tell you, because that's the reason why a lot of people who come to like boot camps, office hours, and say, I'm really having a hard time retaining my patients on caseload. I'm like, well, what's the base barrier? Finance. I'm like, it's not. You guys have to understand that it's
Yeah.
not finances. I don't understand what you're going to do, and I don't know the value. And when there is financial limitations, what are you going to do about that? The only thing that these young guys and gals need to know, what's the
Yeah.
optimal plan? And when that optimal plan doesn't work for me, time and maybe finances are there now, then you have to learn how to have that uncomfortable conversation.
Yeah.
It's not difficult,
Yeah.
it's uncomfortable, right? And you have to understand too, if I have the you know the willingness to tell you that finances are a problem for me, you have to
Yeah.
acknowledge that. That's not easy for someone to say, right? I'm gonna tell you that when I think you're an idiot and I don't believe anything you just told me. I'd be like, well, I can't afford this. And then like,
Right.
but that's them just telling you nicely, like, you didn't do
Yeah.
a good enough job giving me
Confidence.
the confidence that you are
Yeah.
competent to help me, right? The thing for me is like, we know financials are a potential barrier, but we're still not teaching them that we're not someone's accountant. I'm not their power of attorney. I don't control their funding. And quite honestly, that's not my role. My role is to tell them what I believe is optimal. And then I would love to see a test question that actually said, or a role play, like let's just figure out like what we really do every day. What would I say to you, Tom, if you said finances were a limitation for me?
Yep.
There's multiple responses to that. Why aren't we teaching that? That's reality of private
Yeah.
practice, not what's the short-term goals for this patient. They might be different in every case. So like, that's my biggest gap. And then we all know that this is what these young clinicians struggle with. So, but we got to teach them that. Now, granted, I know it's not on the
Yeah.
national exam, but you can't tell me that ethically the way that I treat patients isn't right because I don't look
Yeah.
at finances. There's nothing out there that really tells me what 1 versus 2 versus 3 times a week really should say. So it's all dependent on what that patient presents with. But
One of the things, I walk the patient up. I'm like, here's the plan. Here's the frequency. I said, here's the best plan that I feel is going to get you better the fastest.
Mhm.
Now, I understand that the confines of reality might kick in and it might change.
Yep.
That's okay. It's just going to lengthen this out a little bit, but we're going to work within the confines of reality, right? Whatever that is.
Mm-hmm.
So I kind of head that off and let them know, like, here's the best plan. Here, I'm putting my best foot forward to help you in the fastest and best way possible.
Mm-hmm.
But I get it. Life gets in the way. And if it does, that's okay. We're just going to adapt and we're going to change the plan, right? Just know, like, it might just take a little longer now, but there's going to be more work on you.
Yeah.
If you can't come in twice a week, well, one of those sessions, like, you're just going to have to do more of your exercises at home and make sure you're doing all the stuff and all the education stuff. That's fine.
The reality is you have to give them permission to also realize, like, it's okay if it does take a little bit longer. But the one thing I've learned too, Tom, like especially with clinician training these days, is people hear a certain thing as opposed to interpreting the information. And I'll give you an example. So most people, I've heard feedback where it's like, Darryl says he doesn't discharge patients. That goes against college. And I got an owner calling me like, oh, this guy's really pissed. And I'm like, yeah, I don't discharge any of my patients. I close every single episode. Well, I should. Every single episode of care. But why am I discharging a patient as a primary healthcare provider? So there's a disconnect there. The other thing too is I often hear Darryl says 2 times a week. I give you like 4 different scenarios in that slide, but all you heard was 2 times a week. That's sort of my standard piece where I'll kind of work off of like, okay, what's my timeline? Is that sufficient? Okay, what are finances? What's this person's availability in every week, right? Maybe I actually have to do virtual, heaven forbid. Like, fuck, that worked before and now we just stopped doing it. Like, it actually does work. But the thing for me though is the one thing that I still see though is this unwritten rule that if I get you better faster, I'm a better
Right.
physio. I'm a better chiro, right? But for me, what I say to people, which often gets misinterpreted, is I think you need to improve how well and how quickly I can get somebody out of symptoms so I can do what I'm really skilled
Right.
at doing, right? Calm shit down,
Yeah.
build it back up, and then
Yeah.
maintain that and potentially improve even what they didn't
Yeah.
know they were capable of. But for me, what happens in a lot of these cases, I calm shit down and I start to build it back up, and then they
Right.
stop coming. And then you and I go, hey, physio so and so, you really should be seeing patients more often or for more visits. And they're like, oh, that's a business thing. No, no, no. Like, let's just look at this. How did that patient return to that activity, and how did you know they were actually, let's say,
Yeah.
strong enough? They had enough endurance to do that.
No.
You don't know. So when I see them 4 more times than you don't see the value in that.
Yeah.
I'm not still doing some bed
No.
exercise, but it's just how people interpret things. So for me, it's like get them out of calm shit down as fast as you can, reasonably, and now start to build back up. And how long do you
Yeah.
have for that? There's not really a shortness to that window. It depends on what that patient needs to
Yeah.
return to doing.
And
And then how do you
yeah.
keep them there? That's the secret. How do
Yeah.
you
And
keep
then
them
they end
there?
up coming in with new goals. They're like, oh, I didn't realize my potential was this. Okay, well, let's reassess. Yeah, we can still work on some things. You know what? We'll keep you for another 1 or 2 weeks to strengthen this up to make
Yeah.
sure everything's bulletproof. As you progress back to sport or activity, let us know how you're feeling. Like, did you only play half a
Mm-hmm.
game? Did you play 75%? Or are you playing 100%? Not worrying about it. Well, great. There's another metric right there.
That's right.
You played an entire game of soccer, not thinking about your knee or whatever it is. You played the game and you weren't sore
Mm-hmm.
after. Great. I mean, to me, like
Yeah.
that's the best test. But if you're like, you know what, it's still kind of flared up on me halfway. We still have some work to do. We still have to build some capacity in that.
Yeah.
Because if we just let you go back and play at 100% and I discharge you, you're gonna be back on my table, and now you're out of the game for another 3 months.
Yeah. Well, and the thing too that's really interesting on that, right, is when you do, they end up on your follow-up list. You go, no, I'm doing good. Okay,
Yeah.
symptomatically you're doing well, but what's the objective component to that? Like, what are they assessing? And that's the same thing too
Mm.
that we often see is the patient doesn't have any real way of measuring
Yeah.
themselves, right? Um, but I think this is sort of where there's a lot of misinterpretation of what we try to get clinicians to do, which is really about seeing a patient from the start of that
Yeah.
trouble, right? Because they're coming in because they have a concern, right? Now, how do we get them to a point of not having to rely on us as much? But here's the interesting thing. What percentage of our patients truly leave our clinics at 100%? Not
Yeah.
that many, right? They're all well on their way. So then when we say to them, hey, you have to do a reactivation call, again, it's another business and driver. There's nothing business related about that. I left you were 75% of the way you felt. Objectively, you've improved quite a bit. You're gone back to soccer. And now I'm going to rely on you to call me if you need me. Like, that's the stupidest script that we've ever been told to use, right? I want to know, Tom, I'm going to call you in 2 weeks and I want to know how the soccer
Yeah.
tournament went, right? If you need to talk to me before then, it's on you
Yeah.
and you call me. But otherwise, I'm touching base with you. Are you good with that? Yeah. Put it in your
Yeah.
goddamn schedule. Set a task in your EMR. Call Tom.
Yeah.
It's not hard. So I shouldn't have to tell you to do reactivations anymore. We have a strategy for it. I can tell you a step from 1 to 10 how to do it. But why do I have to tell you to do it?
Yeah.
That's my problem, right? You don't have that many patients on your caseload.
Yeah.
Like we don't. Just
Yeah.
follow them up.
That comes back to, what makes an all-star clinician. And we have the 3 C's when we're looking to hire: good communication, because that's where that falls in. Can you communicate with the client, which is then going to set expectations? Are you coachable? And do you have a continued desire to learn? We call this the 3 C's for when we're hiring, and if they're going to be a right fit in our clinic. But that builds back on top of that of with coachability, you're giving them all the tools and the frameworks to be successful, to make sure that they're doing the best they can as a clinician. Are they following it? Yes or no? It's as simple as that. And if not, why? Am I saying it the wrong way? Do you not You do not buy into it, do not see value in it. And if I have to sit here and convince you of all these things, what are we doing? Not the right
It's
thing.
not the right fit.
Exactly. Yeah.
Yeah. But your three C's are bang on.
Yeah.
Right. People have to understand that how we're even trained in school is great, but we're not really trained on how to use this clinical
Yeah.
competence and communicate that we're there, right? And I think that's also the disconnect, right? Is when you're thinking about some of the gaps in the educational system. So Diane Hopkins, Rusile, and I, we actually did a Delphi study looking at what were the business and practice management competencies that, you know, right from private practice clinicians, students, new grads, regulators, association individuals, academics thought we should have over 50 competencies that weren't in our
Wow.
curriculum yet. But the reality is there's no
Yeah.
room in the curriculum. So, okay, what is it that we have to do? But there's a message there that says it's a very important component of what we do. But I think it's the part where people misrepresent the word sales, right? But you're right. Like, you're in the private sector. You have to be able to sell and communicate your expertise and your scope. So if you want to change sales to advocate, go for it. I don't really give a shit. But the reality is you actually have to explain to a human across from you why you're the provider of choice for them.
Yeah.
That's
Yeah. I mean, you know, mentioning that there's not enough room in the curriculum to teach these things. You know, the US has switched to a DPT program, right? So they get that extra third year.
Mm-hmm.
And what would it look like if, let's just say, you know, you can stay for a third year into a DPT, but then you specialize in advanced orthopedics or clinical practice, or, you know, even with the FCAMP, the Minute Masters. Why won't you just tag that on as a third year option to go straight into that too?
Mm-hmm. I like, for me, and I won't name who I've chatted with about this, but I know some of them are in the academic world too. Having a third year residency, like if we look at medicine, like there's, you know, you're a resident and then you're a fellow, like, you know, there's all these opportunities for individuals. Like, could we at least, even if we don't have the ability to turn it into a DPT because there's just so much political red tape there, but could we even have a residency for people?
Yeah.
Right. With some structure to it, right? Like, what could that look like? I think we sell ourselves short thinking that I could come out of school and just start practicing orthopedics in a private setting without, if I kind of remove all the mentors that I had. Like, I just got really lucky, quite honestly. I just was surrounded by good people that I went through my post-grad training with, like you and, you know, Jeff, you know, Ron at the time. I was trained by some of the best around. I got lucky, right? Not everybody is as fortunate as me. That's the problem, I think. So how do we help some of those that just didn't get into that, you know, circle? Because I just happen to be in an urban center where I could go to U of T, right? I could go to Western to get this mentorship and post grad training. When's if I lived up north?
No, it is hard.
It's hard.
Yeah. What's, you know, being in the right place at the right time, kind of lucky, you know, how do you help mentees kind of recognize and capitalize on kind of those gate moments in their careers, those primary moments, and realizing that they are in a situation where they're lucky to be there. Meanwhile, they might be reflecting on it, like, well, maybe the grass is greener over here. How do you help them realize, like, you're in a great place right now? If this is the path you're looking for, you want to stay here. If you want to be exceptional, you need to work here. Right. And because social media is just like, it's a comparison field of, well, my classmates over at this clinic, and look how great their social media is. I'm like, yeah, maybe, but is the grass greener? Have you talked to them? Well, they're making a 60% split. Yeah. How full is their schedule? You know, if they're only 50% full but they're getting a bigger split than you, and you're 90+% utilized, who's making more money? But nobody says that, right? How do you help the ones you mentor to realize you're in actually a very good situation right now? You just need to not grind it out, but you need to, you know, stay the course, and then all of a sudden you'll just accelerate in your career.
Yeah, I think without a doubt, I see it a lot. lot too. Like the grass is always greener, right? Because everybody's desperate and owners don't listen regardless. Just they like stop playing in the fee split game, but they're like, shit, I need a physio or I need a chiro, right? So it's always presented that the grass is greener. The reality is people are just misinformed, right? Especially a lot of the younger practitioners. Like what I know now, I sure as shit didn't know when I was a new grad. But I also didn't really have a lot of people telling me because the landscape wasn't nearly as competitive as it is now, right? So my favorite point when someone does think the grass is greener a little bit, it's okay, you've got to pull them back and not have the conversation at that level. Because again, it's a forest versus tree scenario, right? They're seeing the tree right now. Okay, let's pull back. Where do you want to go in your career? Where are some of your biggest pain points right now? Right? What is it? What motivates you? Right? Well, and I see this all the time. I'm going to open my own clinic one day. Great. You should. But do you understand how to run and operate a business? Have you even spoken to your clinic owner where maybe there's the opportunity for partnership one day? Maybe they have a growth journey. I think one of the things too is I think when we start to see people in practice too, we also try to deliver just what they want, which is really around the clinical side of things. And maybe we'll throw in practice management because of what we do. But sometimes I think we almost forget to say, like, where do you really want to go now? Right? Like, how can I help you get there? So I feel like they don't oftentimes, just like patients don't know where I want to take them, as their plan was to progress. I think at times too, a lot of our clinical teams don't know that we have a vision to go from this one location to maybe 10 clinics in 10 years. And they could be part of that journey. So they start looking, right? And I mean, we have to assume that everybody's looking.
Yeah. And I guess,
right?
Because I guess that's where showing them the path, showing them the direction that the company's going, the growth, the potential, the future outcomes, and how they can be a part of that and how they want to be a part of that. Right. So, yeah.
And I think what you said earlier too, John, like you've got you and Kylie have built the 3 C's into the mission of the business, quite honestly, right? That's how you guys are treating staff. Then you've got this other piece of you guys have your vision of where you want to go, but you already showed them a bit of a career pathway, right? Like, hey, where do you want to be? Like, you want to end here? That's cool. Like, we have a path for that. And I think we underestimate how important that is, especially with this younger generation where people are getting kind of bored at 3 to 5 years. Like I was bored in 7 years. You know what I mean? Like that was the old itch, right? Whereas now the itch is much sooner. And everyone's knocking on your door for a job.
Yeah.
Right. And I think when you're not fully aware of all the factors that go in, you can only hold your hat on one, right?
Yeah.
Split. So those are the things too, for me. It's like, it's an opportunity. Every time I meet somebody that, thinks the grass is greener, it's an opportunity to kind of either, well, one, to educate them on what they really should be looking at, and then reinforce those that are in great positions.
Yeah. Well, when I touch upon, because it's going to affect everybody in some way, AI, how do you see that working in our profession, in our field, at what capacity? And then, how do you feel that as practitioners and clinic owners adjust for what's coming down the pipe?
Yeah, it's an interesting one. I think this is where having some of our younger clinicians really helps us as owners too, because I'm going to use it. We still use it now. It's certainly improved things. I was even chatting with my uncle who runs a huge plant, and I was like, he's old. It was hilarious. We were making fun of him because he still brought like gel after hockey. He still has the comb, and I swear to God, he had that comb when I was born, right? And I was like, how are you going to use AI if you're still like using a comb after hockey? He's like, shut up, right? He's like, I use AI every day. And I was like, well, what do you do with it? He's like, oh, it's making things so much faster, right? It's the efficiency piece. I honestly think too is that's where we have to be a bit strategic, right? How we utilize AI to improve efficiencies, improve predictability. Like honestly, prognosis and predicted outcome are very hard for people, right? So how could we use some of those prompts as maybe a guideline? Because we know no one's going to read the research as like we had to in the past, right? Like it's all at like the tip of a button if you know how to use the prompts, right? So I think for a lot of people, it's going to be how do we use prompts? I think it's still very superficial right now, right? Well, I'm going to get somebody to do my chart notes. Okay, cool, right? But the amount of time that's going to go into the regulation around it. It's not going to be into the educational system. So we're going to be the first people that students
Yeah.
see using AI. But I think it's going to be a powerful tool to improve efficiencies. It's still not going to be able to, in my mind, be able to really interpret what happens on the connection side between you and me, patient and therapist. It's not going to be able to replace that. But could it allow us to speed up parts that are kind of maybe a little bit slower, right?
Yeah.
Treatment planning, how we come up with a plan of care so we can spend more time connecting even better with patients. That to me is the end. That's our leverage point. Could we shorten appointment times to see more patients? Now everybody's going to freak out and be like, it's going to affect care. It probably won't.
Yeah.
Right. It's how we best utilize time with people. How do we better support patients between sessions? I think AI is going to help us do that as significantly. On the owner side, it's going to be a huge opportunity to streamline a lot of our systems and processes, put data into scoreboards, really improve marketing, outreach and outbound. Like, I think there's going to be opportunities, but it's going to be, how do you use it strategically and can you execute it? And if you can execute it, find someone else who can.
Yeah.
Otherwise, you're going to be left in the dark.
Guaranteed. Cubans, I guess. Kylie was telling me, oh, shit. There goes my battery. Yeah.
Generator.
Cuban was talking about, he's leaving Shark Tank and, oh, shit. My one battery. He's leaving Shark Tank because he's focusing on AI stuff, right? And he's like, look, if you're not using AI, you're dead. Like, you have to integrate, you have to adapt. So we've at our clinic, we've taken some, so we've got some AI machines coming in from Switzerland, and it's going to measure like lower body strength, proprioception, power output, and we have an upper body one. We're going to be the first in North America to bring them in, and it creates a data flower around all these deficiencies, and then it creates games. So it's got a big screen TV in front of you, and then it creates like downhill skiing and bowling and all this. But then it pumps out metrics onto, hey, look, you've improved 10% in your ability to hold tension on your left leg. Oh, look, we've measured rotation power on the left side. We've got increased proprioception, and we have increased reaction time in your core. So we're not using it to replace a movement coach or a therapist, but we're integrating this technology into knowing, okay, you know what? The machines picked up, your inability to hold tension on that left leg. We need to do more isometrics in your rehab at these specific angles, because it pumps out all this data and it sends it to the client. But then you can also send it to the surgeons too. It's just one push button, and then they can come in, sign in, and they just do their AI rehab session.
Mm-hmm. Well, the thing too for me, Tom, like where people have to think about this as well is like, I don't have to operate those, that tech right now, right? And same thing too is I have to do what I'm really good at, which is interpreting information, interpreting what a human in front of me needs at all physical and mental levels, right? Figured out who should be involved from a team perspective, medicine, rehab, wellness, right? But I can now expand who I can actually serve because I have a team that's around me. So I can use my assistants for that. I can give them some autonomy because I can now take some of that data, throw it into a system to say what is the most appropriate or best evidence to treat this asymmetry. It's going to spit out a bunch of shit. It may not be appropriate though for that patient, right? So I may have to look at it to say, okay, if this is what we're doing, Tom, you were a gymnast. I was a hockey player. Yeah. Right? How do I now take that? We may have the exact same asymmetry, but we have to treat it differently. Maybe not in the early stages. Same thing too is, why do surgeons send patients to me? Because they don't know why they're stuck. They just know rehab will help. So same thing, like data is going to drive the industry, right? And I think when we used to think about big data driving industry, it was always on the research side. Well, now you've got this other data driver that can scour the research and a whole bunch of other things, which could be bad too, right? That's why you got to be cautious in how you use it, but don't use that as your excuse not to start to play with it, right? But that's what you and I are here for. I can now interpret data. I can change how I practice, and I think that's what our industry is not ready for. it's going to change how physios practice.
Yeah, I agree.
And it may make me use my hands a little bit less. May not, right? But I think that's what people are afraid of. Think of it, but you have to remember when you're challenged by that thinking, right? Or maybe that fear of that, you're not going to be replaced. But the reality is, think about how many other people we could actually be helping that don't even know we exist, or quite honestly, don't want to be on our wait list.
Yeah, it's true.
Right. So to me, that's a huge opportunity. So like the fact that you guys are bringing this in, people have to realize there's a cost to that. There's an expense and a huge risk to being pioneers in this field. So kudos to you and Kylie.
Yeah, so we're pretty excited about that. So we set up an affiliate relationship with them. So we'll be kind of the North America hub. If clinic owners want to, see the machines, they can come to our facility and see it there. And so it's gonna be sweet. Now I want to close out. What's some of the best advice you've ever received, and what's some of the worst advice you ignored? And then we can even flip that around. What's some of the best advice you ignored?
Yeah, I think best advice I've ever had is to stay focused and I think and this kind of goes well, I think in the entrepreneur world, we're really good, especially as clinic owners, we're really good at following those shiny objects. We start something, we don't finish it. And my wife does that all the time, especially with home improvement. I start something, I never finish it. It's good enough, right? It's 80%. So I think for me, the best advice that I have ignored actually is be focused on, what your true, passion is at the moment and see it through, right? Or small little projects in that. And that's sometimes what I ignore, right? Best advice I ever had is network with people within your industry and network with people outside of industry. And I think for me, the best advice though, is getting that ability to network outside of just physio and rehab, mentors outside of that I would say is probably the best advice. And I don't think I actually really got any advice, like bad advice that I ignored. I think it was more about just trying to figure out, does it fit with the values that I hold, right? So I think you always have to be true to that. But at the same point, though, you almost need to use that a little bit to kind of, check your values. Like maybe again, I'm staring at trees and I'm not seeing the forest, and someone's just trying to help me see the forest. Because, as an operator, I like to be, hence the COO title, right? I love to be an owner operator, but sometimes I'm stuck in the weeds, right? I don't see the bigger vision. So I think that's the advice I often ignore because I don't like it.
That's awesome. Total sense.
Yeah.
Ladies and gentlemen, the Darryl Yardley. Thanks for coming, my friend. Where can people find you?
Yeah, probably the easiest way, to be honest, because everything's there, is just through Instagram. So at Darryl Yardley is the easiest way. And then if you just need to get a hold of me on the clinician side or the clinic owner side, just Darryl at clinicaccelerator.com. Those are your
perfect. I'll make sure to put those in the show notes, and we'll do a part 2 soon because there's a lot more things I'd like to talk about. All right, my friend.
All right, buddy. Good to see you.
Thanks for listening to this episode of Staying Relevant. If you enjoyed it, check out the AMT certification at amtcertified.ca, where we help clinicians and coaches get better results faster. Don't forget to subscribe for more episodes and share this with a coach, clinician, or athlete who needs to hear. Until next time, keep learning, keep growing, and keep staying relevant.